Hello to whoever is watching this video. Thank you for joining me. My name is Dr. Noga Schiller and I am the Veterinary Medical Advisor at Biogal Labs. I also worked for many years as a veterinarian in small animal clinics, and today I am doing the second video of a series of videos about the world of canine vaccination. And today I would like to talk to all of you about puppies. So many of you watching this video probably have had puppies or have just adopted a puppy, and especially for those who it's their first dog, it can sometimes be pretty overwhelming. Puppies are extremely adorable, but they also come with a lot of responsibilities and a lot of new information about how to keep them healthy and happy. And so I wanted to do this video today to try to kind of give you the information and the knowledge that will help you make the right decisions for your puppies, and especially when it comes to puppy vaccinations. But let's start from the beginning. So a female dog will give birth to anywhere between 1 and 12 puppies. So it can be vastly different. On average, she gives birth to between 6 and 8 puppies in one litter. But like you can see, it can change drastically. Our large breed dogs do tend to have bigger litters than the small breed dogs, so they will have more puppies at once. Puppies are born pretty helpless. They're born with their eyes and their ears closed, so they're blind and they're deaf, so they're really dependent on their mother and on their pet owners. They will begin to open their eyes after about 10 to 14 days. What is a puppy? How do we define a puppy? A puppy is a dog that is still growing. Usually this growth will stop at around 12 to 18 months. Also here we do have a difference between our small breed dogs and our large breed dogs. The small breed dogs tend to finish growing at around 12 months, and the large breed dogs will continue growing up to 18 months of age. Puppies sleep a lot. If you've had a puppy or you currently have a puppy, you notice that. They do sleep a lot. They can sleep up to 18 hours a day, and that is completely normal because they need to sleep in order to grow. What we will see when the puppy is healthy is that in that window where they are awake, that 6 to 8 hour window, they are extremely energetic. So if they're energetic when they're awake, but they sleep a lot, that is perfectly normal, and your puppy is perfectly healthy. Puppy food is different than grown dog food, than adult dog food, and it is really important to give puppies their special food up until 12 to 18 months of age, because this food does have more protein and fat, which is really important for muscle growth, more calories because they spend a lot more energy, puppies, and they do have a level of calcium and phosphorus that is the correct level for bone and teeth development and growth. So it is really important to give puppy food. Speaking of teeth, let's talk about teething. So a dog will have 28 baby teeth, and those are replaced by 42 adult teeth. Puppies are not born with teeth. Their baby teeth will they'll finish growing at around 3 months of age, and then between 3 to 6 months, the baby teeth will fall out and the adult teeth will start growing. This change of teeth is really useful for veterinarians to assess the age of the puppy. So we see how many baby teeth they have, how many adult teeth they have, kind of where they are, and we can assess up to 6 months of life, more or less how old they are. After the 6 months, after they have their adult teeth, it is much harder to assess the age of the dog. Really important to remember and to understand is that teething hurts. This replacement of teeth, this growing of adult teeth, is painful, and that is one of the main reasons why puppies bite and chew a lot. They also bite and chew because that is how they explore the world with their mouths, but also because it really is uncomfortable and quite painful, the changing of the teeth. And it's important to understand that because at that age and in that period, a lot of puppies, one of the puppy behavioral problems, or one of the things that are harder for puppy owners, is that they will bite your hands and your feet, and it can hurt. Those are little sharp needles, their teeth. but we don't want to necessarily make them stop biting or chewing at all, because it is really natural behavior. What we do want to do is teach them what to bite and to chew. And for that, we really need to give them a variety of things to chew toys, of bones. Also, frozen treats or frozen bones or even frozen toys are a really good thing because it helps numb the pain. So remember, don't try to necessarily get them to stop completely the chewing behavior, but to teach them what they need to chew. And then with time, they will stop with that chewing behavior. The socialization period, it's a really, really important period. What is it? It's when they learn to interact correctly with people, with dogs, and with their environment in general. The socialization period has a critical period, which is when the puppy is between 3 and 14 weeks of age. Why is this period so critical? Because the puppies at this age are more accepting, they're less cautious, and they're more curious. If there is a lack of exposure in this period or improper exposure, it can lead to a more fearful dog. So this is a really important period. How can we properly socialize a puppy? So the main point is to expose this puppy to a variety of experiences, to all different kinds of noises, especially if the puppy is going to grow up in an urban environment. So the buses and the motorcycles and the people shouting and the music and all these things, all these noises that we who have grown up in an urban environment are really used to, the puppies are not necessarily that used to growing up in this environment. So the more we expose them to that in this critical period, the less chances that they'll then be fearful of these things. Also, different objects, for example, the broom or the vacuum cleaner or all sorts of things, stairs. Puppies can grow to be a little bit more fearful of these things, so exposing them is really important. Of course, other animals, dogs, but not just dogs, cats. If you have other animals at home, then also those, of course, and people, and all sorts of people. Grown-ups, children, babies, men, women. The more variety, the more exposure, the better it is for the dog. These experiences, though, they have to be positive and controlled. What does that mean? So positive means we want to associate all of these experiences to something positive. Usually with dogs, it's treats. So dogs love to eat and they love treats. So if we, for example, go outside with a bag of treats and there's noises and there's chaos and there's all these sorts of things, but we are giving our puppy treats, the puppy learns that, oh, this noise and this chaos is not so bad because I get something that I really like. You could also use toys because puppies are very playful and they love playing with toys. So just associating these experiences with something positive is really helpful. The second thing is the controlled experiences. And what does that mean? It's really important that we look at our puppy, that we understand their language, their body language, and then we notice signs of stress. Because if we have a certain experience that makes the puppy scared, the puppy is stressed, then we don't want to necessarily overexpose him to that experience. We want to teach him that he can walk away, that it is safe to get away from this thing that is making him fearful, and he doesn't have to be in it, and then we will gradually expose it to him in a more positive way. However, we cannot forget that in this same period of socialization, there is also the risk of exposure to diseases, and that is the next thing I want to talk about. What are our puppy viruses? We have 3 main puppy viruses: parvovirus, adenovirus, distemper virus. Now, I do in a previous video talk more about these viruses and more in depth, but I do want to briefly go over some really important points about these puppy viruses. And the first thing is, how does the puppy get them? How does he get sick? So it can, of course, pass from direct contact with a sick dog, but that is not the only way that puppies get these diseases, because it also can pass to the puppy by infected urine, by infected feces, and by infected surfaces. So that means also sniffing infected feces and urine and the grass and the pavement. The puppy can also contract these diseases. It is not really puppy viruses. They can infect also adults, but I do call them puppy viruses because they are more severe in puppies and they tend more often to lead to death. Another really important point is there is no treatment. There is no medicine that will directly kill these viruses. The only thing veterinarians can do is give what's called supportive care, which means help the puppy get stronger, to eat more, for the symptoms like the diarrhea and the vomiting, so that the puppy is a bit stronger and can fight off the disease by himself. But there is no treatment for these diseases. The most important way to prevent these diseases is vaccination. And we're going to talk a little bit more now about vaccination. How do vaccines work? Now, in my previous video, I also talked a bit more in depth about how vaccines work and how our immune system works, but I will go over it briefly. What is a vaccine? A vaccine is basically we inject into the body of the dog a weak or killed microorganism, which in this case we're talking about our viruses. The body will develop what is called a primary immune response. It'll fight off this specific virus, or more specifically the antigen of the virus. It will fight it off. One of the things in our primary immune system are antibodies. Antibodies are created. It'll fight off the disease is eliminated, the dog does not get sick because the virus was weak or killed. However, the body does remember the antigen of the specific virus because the antibodies stay in the body. They can stay for months, they can stay for years. And this is called our secondary immune response. So when the dog is infected by the same virus with the same antigen, the body can react much faster because these antibodies are already present in the body, and so it reacts much faster. It can eliminate the virus, and the dog will not get sick or will get only mildly sick. So when we're talking about puppies, we have something called maternally derived antibodies, or MDAs. These antibodies are antibodies that the puppy will get from their mother in the first few weeks of their lives, and it protects the puppy from the virus. How do they get these antibodies? From the mother's colostrum. The colostrum is the milk of the mother that's produced in the first 24, 48 hours. So the first day or two of their lives, they get these antibodies, and these antibodies will stay in their bodies for a few weeks and will protect against the viruses. However, it will change from puppy to puppy how long these antibodies stay in the body. And they're really important. They protect the puppy against the viruses, but what is the problem with these antibodies is that when they are in the body of the puppy and we vaccinate this puppy, the vaccination won't work. The puppy won't develop these separate antibodies. When is that problematic? So you can see on this graph that I put here that the antibodies are in the body, these maternal antibodies. The puppy is protected, but they gradually go down. At some point, they are low and they won't protect against the viruses. However, they still interfere with our vaccine at this point. So there is a period of a few weeks where the puppy is not protected and the puppy can get sick from these viruses. That is also why we do a series of vaccinations with puppies. We have what is called our vaccination protocol, which I also talked about in the previous video. It's a protocol, it's like a baseline of when we should vaccinate our puppies that is scientifically based. And so like I was explaining, it's a series of vaccinations because we don't know how long these maternal antibodies will stay in the puppy's body. And so we need to give a few vaccinations to make sure that our vaccine is working. So for our three core viruses, our parvovirus, our adenovirus, and distemper virus, we give a first dose at 6 to 8 weeks of age, and then every 2 to 4 weeks until 16 weeks of age, where most puppies will not have the maternal antibodies anymore at 16 weeks of age. For our rabies vaccination, we give a first dose at 12 weeks of age, and in high-risk area, a second dose at 2 to 4 weeks after. And for leptospira, which I didn't talk about in this video, but I did talk about in the previous video, we give our first dose at 8 weeks and then the second dose at 2 to 4 weeks later. So, as some of you might have figured out already, there is a bit of a problem because our socialization period, our critical period, is the exact same time as our vaccination period. It's that period where the puppies might not be vaccinated, might not have maternal antibodies, and might be more exposed to these diseases. So on one hand, the socialization is important for our social development of the dog and to reduce the development of fears. On the other hand, the vaccination is extremely important to protect the puppies from these deadly diseases. What can we do? So in my opinion, the most important thing is knowledge. Knowledge is power. When we better understand the socialization period and we better understand the puppy diseases and how they're transmitted, then we can make better decisions about our puppy and what are we going to do in the first few months of their lives. So what, for example, can we do? We can do what's called controlled socialization. We can evaluate the risk of every kind of type of socialization because, like I talked about at the beginning, we can, for example, do plenty of things in our homes where the puppy is not at risk for these diseases, but there's many, many things we can expose them to also in our homes. Contact with people is really relatively safe because these are not viruses that people have. So exposing them to all sorts of people is also very low risk at this age. When it comes to the more high-risk situations, like taking them outside or meeting other dogs, we do really have to remember the risks and, again, how these viruses are transmitted. Because, for example, keeping the puppy in our arms when we go outside with them to expose them to all sorts of noises and all sorts of stuff is much safer than putting them down and letting them sniff the pavement and the grass and all those sorts of things. So it does come with a risk, taking them outside, but we also do have to understand the types of ways we take them outside and what the risks are. The last thing I want to talk about is what's called VacciCheck. So what is VacciCheck? VacciCheck is a blood test that only requires a few drops of blood, and it will check the antibody levels in the blood of the puppy. These antibodies for our 3 core viruses, for our parvovirus, for distemper virus, and for adenovirus. So why is that really important? Because like I explained before, we have these maternal antibodies that interfere with vaccinations, and we do give a series of vaccinations. However, the only way to really know if our puppy has antibodies and is protected from disease is by checking these antibodies. So if the levels are sufficiently high, then we know that our puppy is protected. We know that we can take him outside, and we know that he's safe from all these puppy viruses. However, if the levels are low or there aren't any antibodies at all, then we know that our puppy is not currently protected and he needs to be revaccinated, and we still need to keep him safe and to kind of protect him from these diseases. So I hope that whoever's watching this video learned a bit. It made stuff a bit clearer about our vaccination protocols and about socialization and about all these sorts of things that have to do with keeping our puppies healthier and happier. And I will see you next week for my next video, which will be the opposite of puppies, which will be talking about our older dogs, our senior dogs. So thank you very much for joining me, and have a great day.